Before you read another word, I want you to do one thing. Take off one sock and look at where the elastic sat against your calf today. If there is a visible groove pressed into the skin, an indentation that stays for 30 seconds or a minute or sometimes several minutes before the tissue slowly levels out, keep reading, because what you are looking at is not a problem with your socks, and it is not a problem with how much salt you used at lunch. And despite what most people over 60 have been told by a well-meaning doctor with limited appointment time, in the majority of cases, it is not a heart problem either. It is a drainage problem. And the system responsible for it is one that almost nobody ever sat down and explained to you. I am Dr. Naira Stein. Today I want to give you that explanation, precisely and completely, and then walk you through a 5-minute daily habit that addresses the actual mechanism of your ankle swelling, rather than treating a system that was never the source of it. I will also be direct about the situations in which ankle swelling is not a lymphatic issue and requires prompt medical evaluation, because that distinction is genuinely important. Your body has 2 fluid drainage networks, not one. Most people are familiar with the first, the circulatory system, in which arteries carry oxygenated blood outward from the hole. Heart and veins carry used blood back. That system has a pump, your heart, and it runs automatically every second of your life without any deliberate effort on your part. The second network is called the lymphatic system. Here is what makes it fundamentally different from everything else in your body's fluid management. It has no pump. None at all. Lymph is a clear, pale fluid that leaks continuously from the tiny blood vessels in your tissues, circulates among the cells, picks up waste products, excess protein, dead cellular material, and excess water, and must then be returned to the bloodstream through a separate network of lymph capillaries and lymph ducts. Your body processes approximately 2 liters of lymph this way every single day. But without a heart to drive it, lymph moves by only one mechanism, the mechanical compression produced by your moving muscles. Every step you take, every contraction of the calf muscle, every flex of the ankle squeezes the surrounding lymph vessels and propels fluid upward toward the chest, where it empties back into the bloodstream near the collarbone. Stop moving, and the movement of lymph stops with it. Sit for 3 hours, and the entire lower leg drainage system essentially stalls. The fluid that should be circulating simply accumulates in the tissues of the ankle and calf, a teaspoon at a time, quietly building the reservoir you will notice by early evening. In younger decades, this tends not to become a serious problem. The lymph vessel walls are elastic, the valves inside them close tightly and efficiently, and even a short walk restarts the system within minutes. After 60, 3 changes occur simultaneously. The lymph vessels stiffen and lose their elasticity. The valves begin to become less precise. And the loose connective tissue matrix surrounding the ankle, the structural scaffolding that holds the fluid compartments in place, begins to lose its own resilience. Fluid leaks out of the capillaries faster, and the system clears it more slowly. The balance shifts, and the reservoir grows day by day. Before going any further, I need to draw a clear line. There are situations in which ankle or leg swelling is not a lymphatic drainage issue and requires prompt medical evaluation. Not tomorrow, today. Please recognize these patterns. If one leg swells dramatically more than the other within a matter of hours, and the swelling is accompanied by pain, warmth, and redness in the affected limb, that combination can indicate a deep vein thrombosis, a blood clot in the deep venous system. This is a serious condition. Please see a doctor or go to an emergency department today. If both legs are swollen and you are also experiencing difficulty breathing, particularly when lying flat, waking at night short of breath, or finding that climbing a single flight of stairs requires you to stop, that pattern suggests cardiac strain beyond the early stages. Please seek medical attention promptly rather than managing it at home. If swelling is accompanied by rapid weight gain, 4 or 5 pounds in a single week, alongside foamy urine, the kidneys may be losing protein in a way that requires blood work and clinical evaluation this week. If the swelling is only on one side, is firm rather than soft to the touch, and you have a history of cancer treatment in that region, please have it evaluated for lymph node involvement. If none of these descriptions applies to you, if your swelling is gradual, affects both legs symmetrically, is noticeably worse by evening, measurably better by morning, and you experience no difficulty breathing at rest, then what follows is written for your situation. 3 patterns of chronic leg swelling, and how to tell them apart. Chronic lower leg swelling in older adults follows three distinct patterns that look similar to the untrained eye, but arise from completely different causes. Understanding which pattern you are shapes what kind of support actually helps. The first pattern is venous. The veins in the legs are struggling to return blood adequately to the heart. The valves inside the veins have weakened, blood pools under pressure, and that pressure forces water out through the vessel walls into the surrounding tissue. If this is your pattern, you will usually see visible varicose veins, and often a brownish discoloration of the skin just above the ankle, a sign of long-standing venous congestion. The swelling and venous insufficiency tends to be significantly worse on days spent standing rather than sitting. The second pattern is lymphatic, and this is the one we are focusing on today. Lymph flow has slowed. The tissue is saturated with fluid that the lymphatic system is not, clearing efficiently. The swelling feels soft and puffy rather than tight. It leaves a distinct dent when you press it. It often involves the top of the foot, the area just behind the toes, which is not a common feature of venous swelling. When lymphatic congestion has been present for several years, the skin on the top of the foot becomes thickened enough that it cannot be pinched into a fold between the fingers. This finding has a clinical name, a positive stemmer sign, and is a reliable indicator of chronic lymphatic insufficiency. The third pattern is cardiac or renal. In this pattern, the heart or kidneys are not managing fluid balance adequately. The swelling is symmetrical, worsens through the night, day, and, critically, is accompanied by other symptoms: breathlessness on minimal exertion, waking several times overnight to urinate, significant fatigue, or rapid, unexplained weight gain. If you recognize this pattern, the protocol described in this script is not the appropriate response. This pattern requires clinical evaluation and medical management. The majority of older adults with chronic symmetrical evening ankle swelling and no additional symptoms fall into the second pattern, lymphatic, and this is the pattern that conventional medicine has historically been least equipped to address, because diuretics, the standard pharmaceutical response, act on the bloodstream and cannot draw fluid out of the tissue compartment where the problem actually lives. A patient story: what 2 years of the wrong treatment looks like. I want to tell you about a patient I will call Dorothy. She was 68 years old, a retired teacher who had lived in the same house for 3 decades. She came to my clinic quietly convinced that her heart was failing, because that is what she had been told to consider. For 2 years, her ankles had been gradually thickening by evening. In the beginning, it was subtle, slightly tighter shoes at the end of the day. Over time, it progressed to the point where her usual footwear no longer fitted. She mentioned it at a routine appointment. An echocardiogram was ordered. It came back entirely normal. Her ejection fraction, the percentage of blood the heart pumps out with each contraction, was 62%, well within healthy range. Her heart was fine, but Dorothy was still swelling. A diuretic was prescribed. She took it for 6 months. She made multiple trips to the bathroom each day. She became tired and mildly dehydrated. Her ankle swelling changed very little. Then she said one thing that unlocked the whole picture. She mentioned, almost as an aside, that when she traveled and spent a day walking around a new city, her ankles were actually better by the evening than they were at home. That single observation told me exactly what I needed to know. Her swelling improved with sustained movement and worsened with prolonged sitting. Her heart function was documented as normal. Her kidneys were functioning appropriately. A venous ultrasound showed only modest, age-related changes, nothing sufficient to explain the degree of swelling she was experiencing. What Dorothy had was a lymphatic drainage problem. No pill could resolve it because the fluid was not in her bloodstream. It was in her tissues. And the treatment for tissue fluid accumulation is movement, specifically the kind of directed, rhythmic movement that activates the lymphatic pump that sits in the muscles of the calf. What is actually happening in your body every day? The cycle that explains everything. Here is the pattern that Dorothy experienced, and that is likely familiar to you. She woke in the morning with ankles that looked nearly normal. After 8 hours of lying flat, gravity had not been pulling fluid downward into her legs, and her lymphatic system had been given the overnight hours to clear much of what had accumulated the day before. Morning represented her closest to baseline state. Then she got up, had breakfast at the kitchen table, drove to her volunteer work, sat at a desk for several hours, came home, and sat again. By mid-afternoon, she had been upright, but largely motionless, for many hours. Fluid had been leaking continuously from the capillaries in her lower leg tissue. Her calf muscles had barely contracted. The lymphatic conveyor belt had barely moved. The fluid was building quietly, a small amount at a time, into a reservoir she could not see but would feel by evening. And then came the problem that disrupted her sleep. When she finally lay down at night, gravity was no longer pulling the accumulated fluid downward. The reservoir in her ankles and lower legs began to slowly reabsorb into the bloodstream. Her heart received an unexpected volume load it had not been prepared for. Her kidneys detected the extra circulating fluid and shifted into increased activity, producing urine. She woke at 2 in the morning, at 4, at 5. By 6, she was exhausted before the day had begun. The cycle repeated the following day without interruption. The solution was not a stronger diuretic. The solution was giving the lymphatic system a deliberate, timed work period, before bed, while she was awake and in control, so that the fluid was cleared before she lay down, rather than forcing the body to manage it chaotically in the small hours of the night. 2 simple tests you can do right now to assess your own lymphatic health. Before beginning the protocol, take 2 minutes and establish your baseline. These are not clinical instruments, but they give you something concrete and measurable to compare against in 2 to 3 weeks. The first is the pit test. Find the bony ridge running along the front of your shin, approximately 4 inches above the ankle. Press your thumb firmly into the tissue there, and hold for 15 seconds. Lift your thumb and observe. If there is a visible indentation, a dent that takes 10 seconds or more to smooth out, this is called pitting edema. A slight dent that fades within 10 to 15 seconds is grade 1. A deeper dent lasting longer is grade 2. A pronounced dent lasting more than a minute is grade 3. Write down what you observe. You will repeat this test in 2 weeks, and the change, when the protocol is working, is clearly visible. The second is the stemmer sign. Try to pinch the skin on the top of your foot, just behind your second toe, between your thumb and forefinger, lifting it into a small fold. If the skin lifts easily into a fold, lymph flow in the area is adequate. If the skin feels fused to the underlying tissue and cannot be lifted into a fold at all, this is a positive stemmer sign, a clinical indicator of chronic lymphatic congestion that has been present long enough to alter the structure of the overlying skin. Make a note of both findings. These are your starting points. 3 daily habits that are making your swelling worse without you realizing. Most people over 60 who experience chronic evening ankle swelling are unknowingly doing 3 specific things that significantly worsen the problem. Understanding these is as important as the protocol itself. The first is hidden sodium, not the salt shaker. Most people have already reduced that. The hidden sodium in everyday foods. Hard cheeses, cured meats, canned soups, commercial breads, condiments, restaurant meals, and frozen prepared foods. Sodium draws water out of the bloodstream and into the tissue compartments of the body. The body retains approximately 4 cups of water for every gram of excess sodium it needs to manage. Research consistently shows that most adults over 60 consume substantially more sodium than they estimate, because the majority of it comes not from what they add to food, but from what was added during manufacturing. Identifying and reducing one significant hidden source, the food you eat most frequently from the list above, creates a measurable reduction in the daily fluid load entering the tissue. The second is sitting after dinner. The hours between 7 and 10 in the evening, the natural wind-down period when most people rest in a chair or sofa, are exactly the hours when the lymphatic system is at its least active and the tissue is accumulating fluid at its fastest rate relative to the size of the reservoir already established through the day. 3 hours of immobility after the largest meal of the day, when digestive circulation is also drawing resources away from the periphery, creates the worst possible conditions for overnight fluid reabsorption. This is the pattern that produces 3 a.m. bathroom trips and morning exhaustion. The third is alcohol in the evening. Even a single glass of wine dilates the small blood vessels, increasing the rate at which fluid leaks from the capillaries into the surrounding tissue. Alcohol also suppresses antidiuretic hormone, the signal the brain uses to tell the kidneys to slow urine production during the night, meaning the overnight fluid reabsorption that would ordinarily have a hormonal governor runs unchecked. 1 drink in the evening produces noticeably worse ankle swelling by the following morning. For those managing this problem seriously, alcohol in the evening is one of the most impactful variables to address. 4 nutritional supports that improve lymphatic and vascular function over time. Alongside the movement-based protocol, several nutritional inputs support the underlying biology of fluid management. These work over weeks rather than days, and they complement the mechanical approach rather than replacing it. The first is adequate water intake, which is counterintuitive for most people managing swelling. The instinct is to drink less in the hope of accumulating less fluid. The opposite is physiologically true. Dehydration makes lymph more viscous and more difficult for the vessels to move. Well-hydrated lymph is thinner, flows more easily, and clears the tissue more efficiently. Drinking approximately half your body weight in ounces of water spread through the day, and tapering intake after 5 in the afternoon to avoid overnight urination supports optimal lymph viscosity without worsening the overnight reabsorption problem. The second is flavonoid-rich foods. Flavonoids are plant compounds that strengthen the walls of small blood vessels and reduce the rate at which fluid leaks from the capillaries into the tissue. The most accessible sources are dark berries, blueberries, blackberries, black currants, buckwheat, citrus peel, and red cabbage. A daily cup of mixed berries has been shown to produce measurable improvements in capillary integrity over approximately 8 weeks of consistent intake. This directly reduces the rate at which fluid accumulates in the tissue compartment. The third is adequate protein, specifically from high-quality whole food sources. This one surprises people. The reason fluid leaks from blood vessels into surrounding tissue is partly physical. A protein called albumin in the blood acts as an osmotic anchor, holding water inside the vessel. When albumin levels are low, that anchor is weakened and water migrates outward into the tissue where it sits. Mild albumin deficiency is common in older adults and frequently unidentified. 2 meaningful servings of quality protein daily, eggs, fish, chicken, lentils, cottage cheese, directly supports the physics of fluid balance in a way that no amount of diuretic can. The fourth is magnesium, which is deficient in a significant proportion of adults over 60 and is involved in the smooth muscle tone of lymph vessel walls. Pumpkin seeds, dark leafy greens, and almonds are reliable food sources. Consistent magnesium intake supports the contractile function of the lymph vessel walls themselves, improving their ability to propel fluid upward. The 5-minute evening habit, a step-by-step lymphatic drainage protocol. This is the central, practical contribution of everything we have discussed. It is not complicated. Every detail has a specific physiological rationale, and the sequence matters. Begin in the morning, before your feet touch the floor. While still lying in bed, perform 30 ankle pumps. Point the toes down toward the mattress, then flex them back up toward your face, 30 times. This takes approximately 45 seconds. It restarts lymphatic flow in the lower legs after 8 hours of minimal circulation, and it prevents the rush of fluid downward into a stilled lymphatic system the moment you stand up. Starting the conveyor belt before you stand is one of the simplest and most effective things you can do for your ankles before the day begins. Throughout the day, set a reminder for every hour you are seated. When it sounds, perform 20 calf pumps. If seated, keep the heels on the floor and lift the toes upward and back down 20 times. If standing, rise onto the balls of the feet and lower back down 20 times. This takes 30 seconds. Its purpose is to keep the lymphatic belt moving through the day so fluid does not accumulate to the point where it cannot be cleared in the evening. An hour of lymphatic stasis is manageable. 7 consecutive hours is not. Before dinner, take 5 minutes of slow walking. Not a structured workout, simply movement. Around the block, through the garden, around the interior of your home. Walking engages the deep calf musculature in a way that seated ankle pumps cannot fully replicate. It activates the larger lymphatic vessels of the leg and accelerates clearance during the period when the afternoon's accumulation is at its peak. This is the most impactful single daytime addition for most people. 90 minutes before bed, lie on the floor or on a firm bed and place your legs straight up against the wall at approximately a 90-degree angle. Your heels should be higher than your hips and your hips higher than your heart. This is the core of the protocol. Stay in this position for 15 minutes. During the first 5 minutes, perform slow ankle circles, 10 in each direction, followed by alternating ankle flexes, 20 repetitions. During the following 3 minutes, place both hands flat on your abdomen and breathe slowly and deeply through your nose, allowing the belly to rise with each inhale and fall with each exhale. This deep, diaphragmatic breathing activates the thoracic duct, the central lymphatic vessel of the entire body, which runs directly behind the diaphragm. Each deep breath mechanically pumps lymph through this duct toward the bloodstream. It is not a metaphor. The diaphragm is genuinely one of the most powerful lymphatic drivers in the body, and deliberate slow breathing uses it deliberately. Spend the remaining minutes of the 15 simply resting in the inverted position, continuing the slow breathing. After 15 minutes, roll carefully to your side and sit up slowly. Then, beginning at the ankle of each leg, use the flat surface of your fingers to apply gentle, slow, upward strokes along the calf toward the knee. Always toward the heart, never downward. 10 strokes per leg. This simplified form of manual lymphatic drainage physically moves accumulated fluid from the tissue compartment into the surrounding lymph capillaries, completing the clearance process. Apply just enough pressure to move the skin slightly with each stroke. The pressure should feel comfortable, not deep or forceful. Within 30 minutes of completing this protocol, you will typically feel the urge to urinate. The urine will be pale and the volume will be significant, 300 to 400 milliliters. That is the fluid that your tissues would otherwise have reabsorbed into your bloodstream over the following 3 to 4 hours of sleep, waking you at 2 in the morning and disrupting the cardiovascular recovery that sleep is meant to provide. You have moved it while you were awake and in control of the process. What happened when Dorothy applied this protocol? Dorothy followed this protocol for 3 weeks. The progression was consistent and measurable. By the end of the first week, the sock indentation that had been visible on her calves each evening was no longer present by the following morning. It had cleared during the night rather than being visible at dawn. By the end of the second week, she was not waking during the night to urinate. By the end of the third week, her ankles at 9 in the evening were approximately the same size as they had been at 9 in the morning. Her echocardiogram had not changed. Her prescriptions had not changed. The diuretic she had been taking was eventually discontinued in consultation with her doctor, because there was nothing left for it to do. What had changed was that her lymphatic system was now being given a deliberate, daily work period, one aligned with her life and her sleep, instead of being left to scramble through the night while she lay awake, exhausted. Here is how to begin. Tonight, do the pit test described earlier, and write down what you observe, the grade of pitting, and whether the stemmer sign is positive or negative. This is your baseline, and you will want it in 2 weeks when you compare. Tomorrow, identify one significant source of hidden sodium in your daily routine, the food you eat most frequently from the list of common culprits, and remove or meaningfully reduce it for the next 2 weeks. This single change has a measurable effect on the daily fluid load entering your tissue. Before dinner this evening, take a 5-minute walk. Not after dinner, when you might be settled and comfortable. Before, when the walking will intercept the afternoon's accumulated fluid before dinner adds to the circulatory workload. 90 minutes before you go to bed tonight, spend 15 minutes with your legs elevated against the wall, breathing slowly and deeply, with the gentle upward calf massage when you come down. Tomorrow morning, before your feet touch the floor, do 30 ankle pumps. Make this the new first act of your morning. Repeat this for 2 weeks, then repeat the pit test. The change, when the protocol is working, is not subtle. It is visible in how the sock fits in the evening, noticeable in how your shoes feel in the afternoon, and measurable in the difference between waking twice overnight and sleeping through. Your ankles are not betraying you. They are a drainage system that has been waiting for the right signals. Give it 5 minutes a day and it will respond. The pattern I want to leave you with is this. Most people over 60 who develop chronic ankle swelling are told it is their heart, given a water pill, and sent home with an intervention that cannot reach the fluid it is meant to address. The fluid is in the tissue. Diuretics act on the blood, 2 different compartments. The pill runs to one room and the problem is sitting quietly in another. What the lymphatic system needs is movement, mechanical compression, and the specific positional and breathing techniques that activate it at the right time. These are not expensive. They require no prescription. They can be done in your own bedroom in the minutes before sleep, and they address the actual mechanism of what is happening in your ankles rather than treating a system that was never responsible. If this conversation has given you something useful, a clearer understanding of what your body is actually doing, and a specific set of actions that work with that biology rather than around it, Please share it with someone whose ankles have been swelling for years and who has been told, repeatedly, that the problem is their heart. They may have been handed the wrong map. This is a better one. I am Dr. Naira Stein. Your body is not failing you. It is asking for something specific. And now you know what that is. Take good care of yourself. I will see you in the next one.